Hello and welcome to Maternal Mental Health Awareness Week. My name is Eve Canavan, one of the co-founders of the week, and today I'm really delighted to be joined by our friend Amy from Colostomy Mama. Before we go on, I want to give a site safety announcement. These information sessions here that take place during Maternal Mental Health Awareness Week are purely for that. Anything that Amy and I talk about today should not replace any advice you've been given by your healthcare provider or your surgical team. And with that, I want to introduce Amy. Hello,
Hi,
how are
thank you
you?
for having me. I'm good. Yeah, very good. Thank you.
I'm really delighted to have you. And I was just saying to Amy before we started this session, we run these every year, and they're these really informal sessions that we either do recorded or live for about half an hour. And we touch on things that people have asked us to look at in our survey that we release every year. When we first started doing these 10 years ago, we focused obviously on at that point postnatal depression, postpartum psychosis, antenatal depression. But of course, I think from year two, we realised people suffer from all kinds of things emotionally in the perinatal space, which is either when they're pregnant or after having a baby, for all manner of different reasons. And one of the things that we've touched on, not very much, I have to say, over the last few years, is the subject of birth injury. And we've done some work with Masick Foundation, who are fantastic, where they've talked about their services. But I think this year, when people filled in their survey, a lot of people were saying to us, healthcare professionals, and I've written it down here, how the average incidence of some birth injuries is around 3.5% for some people. Um, Higher sometimes in the first time after having a child. And then a lot of people were saying to us in the survey themselves that they had suffered some kind of birth trauma, birth injury, um, and were seeking information on it. And your name popped up as somebody that they thought would be really good for us to talk to. And I went and looked at your
Okay.
page. I went and looked at your page, and I know I've said this to you. I think you're just wonderful, Amy. And I'll pass over to you in a minute so we can start off. And I want to hand it over to you so you can talk about your experience. But I wanted to say thank you for coming forward to talk about this because it's in response to people asking us to cover this subject. And the whole point of this year's theme being 10 years of Maternal Mental Health Awareness Week, the theme is a decade of voices. And you are a brilliant voice in this space and someone that I really admire. So I wanted to say thank you very much for
Yeah.
helping us out with this.
Thank you. Thanks.
And from I honestly, I really, really appreciate it. Now before we start, we've gone through a few questions that I'm going to ask Amy to make sure that we're covering some things. But Amy, at the end, please do feel free if there's anything that you feel like we've missed or we haven't touched upon, to add it in yourself. But um, the first thing I wanted to do was hand over to you to talk about yourself first of all and introduce yourself and the work that you do and what your Instagram page touches on.
Okay, so I'm Amy Stead. I'm 39, and I had a birth injury in 2019 with my first baby. The injury resulted in me having a colostomy, which I've opted to keep permanently. I subsequently went on to have another baby in 2021. That was by elective C-section. Although I say elective, I didn't really have a choice because of the injury that I'd sustained in my first birth. So, but then that pregnancy resulted in me having a peristomal hernia, which was sort of inevitable with the colostomy bag. So I basically just kind of document my life post injury, talk about some of the mental health struggles that I had. So I was diagnosed with PTSD approximately a year after I'd had my son in 2019. And that was then going straight into COVID in 2020. So any sort of support I received had to be on Zoom. And I suppose I was looking for anybody who'd been through something similar. And there was a few, but not many. And so as the years have passed, I suppose I just kind of felt like I didn't want my experience, for want of a better term, to go to waste. And I wanted to just kind of put things out there. Sometimes it's positive, sometimes it's the grittier side of things. But I just wanted to put it out there for anybody else who's going through life after a birth injury, who's dealing with it, navigating it, and also the mental health issues that come with that as well. Yeah, so I just wanted to be there for other people, really, because finding people who'd been through it is what helped me the most. I think it actually turned things around for me mentally, and I started to see that life goes on and it can go on and it can be positive. That it didn't have to end with me having a colostomy bag. Like, that wasn't the end of the world like I thought it was. So yeah, so I basically, I'm sort of in a space I don't I don't see myself as kind of anything in it really, except that just that I hope that it helps other people. That's all really. I You mentioned Masic, and they were sort of one of the organisations that I found most helpful. I ended up being asked to be on their council. So I'm one of their council members, and I've recently, in the past few months, become a peer supporter. So I lead an in-person peer support group for them. And I also offer peer support sort of on my Instagram page as well. They direct people to me as well, like that might be in my local area that I can offer support to. So yeah, so that's sort of like where my journey has brought me to. That's sort of me at the moment.
And you know what? I love it because I think I've learned so much from your page actually. And I think when people were mentioning you on the survey, and I think I always talk about this, but I say this in case people haven't seen these before. The awareness week was born from personal experience. So I had postpartum psychosis. One of my big parts of recovery was connecting with other people who had it. Couldn't find many 16 years ago, but I found my few who are now my dear friends, and then and others who went through a different perinatal experience, but their mental health was affected while pregnant or having a baby, and we created the week. And I think we always talk about the expertise of lived experience, and that sounds really fancy, but that's why it's really important, because
Yeah,
actually when you go through it, whatever it is that you're experiencing, you become an expert of your own experience that is then shared by others. So your experience is your own, but there is nothing more powerful than going, I had that too. How did you deal with it? This organization helped me. I found this helped me. These surgical options helped me. And I think, that's where I've definitely learned over the years about my own experience, but about the wider perinatal experience, like what people go through. And I think particularly around birth injury, I think we're looking at your page in particular around combining your experience and the things that you go through. And I know you've mentioned a few things there, and we'll go to the first question on that in a minute. But I think that's why it's so powerful that people are connecting with you, and it's a voice that they recognize because you have gone through similar to what they're going through. And also, I think it's really important to talk about the fact that there is this grittier side. Like I know sometimes people say, why did no one tell me about this in antenatal class? And sometimes it's like we don't want to scare people. And people are like,
yeah,
it's not scary if we know something. I remember thinking, I wish someone had told me something about postpartum psychosis. I had no idea what it was when I got it. And I think it's the same with this. I definitely never heard about birth injury 16 years ago. And indeed, it's only over the last few years that it started coming to prominence and that I'm hearing about it in this space and we're shining a light on it. And so I think that's why it's incredibly important that we really value the voices of lived experience in this kind of arena like yours, so people can get that connection and know that they're not alone.
yeah, definitely. It's really important, I think, because you could see all the medical professionals in the world, but unless they have lived an aspect of what you're going through, they'll never really be able to connect with you on a personable level in that way. So it wasn't till I found those other people that have experienced a similar journey to me that I actually felt like heard and seen. And my feelings about certain things were validated, and my experience felt validated, that, you know, it wasn't in my head. There weren't certain aspects of it that were just in my head. This is real and I'm living it, and other people have lived it too. And that's proof that it's real to me. And that's really important, that peer support is very important, I think.
Yeah, and I completely agree. And I think bringing it back to the beginning, because this is part that really interests me, and I'll tell you I was going to ask you this. kind of in your own words, how would you describe the transition from giving birth or your birth experience to you realizing that you had sustained a birth injury?
Um, it was disbelief, really, complete shock because this wasn't the plan. It's never the plan, is it? But it
And had you
was.
heard of birth injuries? Had you heard anything about them?
Well, I knew that you could sustain tears. I knew
Yeah.
that I'd had some friends who'd had a difficult time because they'd had tears, but not to this extent. I didn't know that a risk would be having a colostomy bag. I didn't know that that was an outcome. And it wasn't just me that was shocked by it. I mean, it was also the hospital staff when I went back into hospital. Some of the midwives that took care of me were just flabbergasted. They said that in their 25-year plus careers, they'd never seen anything like this. So it felt that in itself felt isolating as well because I felt like, well, I'm the only person in the world. That's what it felt like at that time. And I was just in shock. I was in a state of shock, really. I couldn't comprehend um, what had happened. It wasn't so much that I'd torn, it was the result of it. The fact that I was having to have emergency colostomy surgery. And I had this tiny baby who was only a few days old at this point, and then going in for major surgery. And it just, I couldn't process any of it because it was just a huge shock. And I remember sort of being wheeled down to surgery and not being able to control my emotions. I just couldn't stop crying. I'm usually, I think that's something you can kind of stop. But it was just the state of shock I was in, that this is, how could this be happening? I'm supposed to be just at home adjusting to being a first time mum and life with a newborn baby. I shouldn't have to be back here having major surgery and life changing surgery at that as well. So, yeah, I think really it was just shock was the overriding the overriding emotion and feelings at that time.
And you know what? We always see these stats everywhere. And I was looking at some stats before around birth injury. But I think we always see the stats around when a woman has a baby, it's always been told us it's the most joyous time of her life, but we also know now it's the most vulnerable time in a woman's life. And I think you put it there, your baby was a few days old. We talk about pregnancy, giving birth, and people go, well, when you get home, the hard work starts. You hear all these kind of phrases, but you're talking about there's something so dramatic happening to you when your baby was only a few days old. And I was gonna go into another question after that, but I'm gonna just bring it back a little bit because I think we're hearing in the news and quite a lot on Instagram at the moment, people are talking about colostomy bags and stomas. And I wondered, could we give a bit of context? So people might be looking at this and thinking, well, I've been reading about them. What are they? Would you be able to give some insight into that?
Yeah, so basically, a stoma is an artificial, well, not artificial because it is your body, but it's a man made opening. So it's a surgical opening on the front of your body, like your abdomen region, usually, that allows your body to get rid of waste. So some people might have it because they've had bladder cancer. So, like, they have to have it to get rid of their urine. Or some people might have it because they've had bowel disease or a bowel cancer or a birth injury. So basically, yeah, so it's a surgical opening. It's where they bring out a part of your intestine and attach it to the outside of your abdomen. And then you have to wear a colostomy bag or some type of bag over that opening to collect the waste. So that's just sort of essentially what it is.
Sure. What is it you also would wish that people would understand, I think, around what the practical and emotional realities are of living with a bag? So I think at the moment we're hearing quite a lot about it. We're reading a lot about it on Instagram. Some well-known people are talking about their experiences with it. And I think there might be a lot of assumptions around it. And I think kind of what are the realities of living with one practically? and emotionally. You cover this loads in your post. I would encourage people to go. You did
Yeah.
this, like Amy does lots of big posts on this and things to do with prolapse and things as well. But yeah, I think with that, what are the initial? Because I think people will go, "Oh, a stoma, okay. How do you live with one?"
Um, well, practically in the beginning, it takes some getting to grips with because you're suddenly having to kind of use essentially what is medical equipment. And, you're every time you need to do a poo, you don't have control over that. Your body is just getting rid of it into the bag. So it's not as simple as just going to the toilet anymore, which is something that most people don't have to worry about or think about. But yeah, so it involves kind of getting to know all the different types of equipment you might need, sprays, swabs, different types of bags. Not everybody suits the first bags that they're given. So it took months for me to find a bag that fit right for my stoma. You deal with sore skin initially, and for some people that can be ongoing. So for me, it can be on and off where I get sore skin or ulcers around the stoma. So then you're dealing with the other side of having to find solutions for that. Um, there's the risks of blockages, which I've had. You're having to get to grips with kind of learning what you can safely eat and what might cause a problem for you. So things like wheat corn that have tough skins that are not easily digestible. Like I'll have them in small amounts, but there's foods that I used to like having a lot of mushrooms, things like that, tomatoes. I have to be very careful with those, as I've learned. But so it's not just dealing with the fact that your body has changed and that you're now having to sort of wear this bag. It's all the other aspects of life that can change with that as well. And then obviously I developed a hernia, so then we're sort of talking about what clothing I can wear that's comfortable, having to wear hernia support wear. So it can be sort of like never ending in a way of all these things that you're continually having to adapt to. Now that's not the case for everybody that's got a stoma. Some people have very few issues. Some people will never get a hernia. Some people don't deal with sore skin. They might have maybe a couple of blockages in their lifetime, but for some people it's pretty smooth sailing. For others it can be worse. Some people deal with their stomas prolapsing as well. So it's something that can kind of cause you anxiety as well. So if you're already dealing with um, some mental health issues for the reason that you've got the stoma, then having this on top of it when it can cause more anxiety can kind of exacerbate things. So I think it's a big mental adjustment and not everybody deals with it very well. I've come across a lot of people now who have stomas, and some people can't look at theirs. They don't want to deal with it. They won't show their family. There's people I know that have had loved ones who had a stoma bag and they would never let them see it. They didn't want to show it to them because there's still a lot of shame, I think, attached to it for some people as well. There's a stigma around it. Um, so there's a lot of things to kind of like dealing with when you have one. It's not just that physical side of, oh, I'm having to learn to change my bag, and it's all of the mental aspects as well.
Do you know what? I think I'm going to combine the next couple of questions I was going to ask you because I think that's so interesting. I think it talks about in your experience, this happens so quickly after having your baby. And so you're adjusting to being a new parent and what parenthood brings, but you're also adjusting to the life you've just talked about and
Yeah,
all the different things that you've got to do to go along with it. And I think we currently think at the moment, like I said to Amy, I was going to ask her about like, there's a kind of obsession for society about bouncing back after you have a baby. But your experience was very different to that because you were focused on different things. And then I was going to talk to you about the support you got from healthcare professionals, but I think I'm going to balance it together with what you've just said. This all happens very quickly after having your baby. You've had surgery, you're getting your head around all these different new things that you've just talked about. What support did you get from healthcare professionals? So you've talked about the reaction. A lot of them hadn't seen it in their career. So you have your operation, you're in hospital, you're thinking about your future ahead, going home. What did support look like? Does that make sense? You think so.
Yeah,
I was in
yeah.
hospital thinking, I don't think I'm feeling very well here, and I remember not knowing how to even put a nappy on Joe in the middle, saying to the midwife, like, what do I do with him? What did support look like after your surgery that you were rushed in so quickly for? You talked about your crying, you're taking everything on board very quickly, trying to process it. You come out, it happens. Yeah, what was the support you got to think about how you work with this in your future?
So I suppose somewhat surprisingly, no mental health support was forthcoming. Um, there was a lot of there was a long line of surgeons coming in to apologize for what had happened because it was caused, the injury I had was caused by negligence and it was missed. And if it had been identified at the time, I never would have needed a colostomy bag. So there was a lot of apologies. There was a lot of, I suppose, passing the blame to certain people, but not one person kind of stopped and was like, do you know what? You're going to need mental health support when you get home to adjust to this new life and to help you process what's happened. Nobody said that. There was a lot of kindness I received, and I had a really great stoma team. So my stoma nurse would come out to see me at my house to help me with bag changes for the first few weeks and just till I got to grips with doing it myself. I could phone them with any issues I had, like post-surgery. My colorectal surgeon was amazing. And he also was very sympathetic and made me know that he was there if I needed to call, if I needed to get in touch with him, that was possible. But in terms of kind of like the side where it mattered more with my mental health and the injury I'd just sustained, it was a case of kind of like, well, we're going to refer you to this specialist unit in another city, and you just have to wait till you get an appointment. We'll and I remember the midwife, my community midwife. She's an older lady. She'd been doing this for a very long time. She's very experienced. She came to see me at home. She checked sort of my stitches, and she said, "Is anyone at the hospital going to see you? Like, are they going to check your stitches?" And I was like, "Well, nobody's given me an appointment. Nobody said anything about it." And she was horrified, and she said, "We need to get them to see you. This is their this is their problem.
Yeah.
They've caused this. They need to see you." So I eventually went in, and I was checked by a senior consultant, and she checked that like my initial injury had healed, and she asked me how I was doing. And in this sort of interim period of being discharged from hospital and seeing her, I'd gone to the supermarket one day, and I was trying to be normal, even though nothing about the situation was. But I was trying to do normal things. And I went to the supermarket and I saw one of the doctors who'd been in attendance on my son's birth at the checkout at the supermarket. And that was the first time I realized that there might be something wrong with me mentally, because suddenly everything just felt hot. My chest got really tight and I didn't know what was happening. It was like, like this wave of something was coming over me just at the sight of him. And I just remember feeling incredibly panicked, like, I've got to get out of here now. Like, I need to leave. I've got to get out of this place. I can't look at him. I can't be near him. Like, I need to leave. And at the time, like, I didn't really understand it. But now I know, that it was a panic attack I was experiencing. And when I relayed this to the consultant when I saw her, she said, "Oh, perhaps we need to get you some mental health support." And she said, "There is a newly formed perinatal mental health team in our health board." So I agreed to that and I was referred. And I'd started to kind of have like really irrational thoughts as well. I was having a lot of intrusive thoughts. I couldn't carry my son downstairs. I mean, partly because of post-surgery pain, but also I was convinced I was going to drop him if I carried him downstairs. And it was just all these awful thoughts all the time that something bad was going to happen to him. It started to get to a point where one of the consultants that had been present at his birth, I had this irrational fear that she'd just pop out from somewhere when we were out for the day. And I don't know what I thought was going to happen, but that fear was always there that she's just going to appear. She's going to be there, like when we're out for a walk, she's going to jump out from behind a bush. She could be hiding behind that bush. And I felt like I was going mad because I just thought, the logical part of my brain thought, what are you talking about? What are you thinking? Like, that's not going to happen. But then I was having nightmares that she was stood at the end of my bed, that she'd come to take my baby away. And I didn't feel like I could tell anybody either at the time, because a lot of family and friends were very sort of like, "Oh, you're coping really well despite what's happened to you. Like, you look amazing. You look great." And, I know from their point of view, they wanted to give some kind of reassurance. And, none of them have ever been faced with having a friend or family member who's had an injury like this, who's, a lot of them didn't have anyone in their lives who had a colostomy bag either. So that was new territory for them. My parents, bless them, just they felt, I suppose, well, they kind of acted a little bit like it was the end of the world. And that was, I think, just because of like societal stigma over colostomy bags. They didn't know anything really about them, or it was very limited what they knew. So that didn't really help things. So I felt like because they were all dealing with the emotional fallout as well for them, I couldn't kind of say like, "Oh, I'm actually not doing very well, like I'm not coping." And there I had the health visitor come in to visit, and she would say, like, "This is probably a stupid question, but how are you mentally?" And I just sort of sit there and think, well, I can't really say that, I'm going a bit mad, and I'm having all these like really irrational thoughts. I'm having nightmares because what if she calls social services? What if she, says that I can't look after my baby? And, and I know now the rational part of me that's well now knows that never would have happened, that they would have provided support if I'd been totally upfront and said, "Actually, I'm really not coping well mentally with what's happened to me. Looking after my baby, I was fine. I could do that. I've had a lot of babies in my family." So that side of things was, aside from being tired from sleepless nights and things, that actual caring for him was the easiest part of it. What was hard was not being able to fully care for him myself. My husband did an awful lot of the care in the first few months. And thankfully, luckily, he'd already had a son years ago when he was younger. So he's well experienced in looking after a newborn baby. But I know for everyone that's not the case. And I'm very, very fortunate that he was able to step in and take over, because there was a lot that I couldn't do. And so there was that adding to it. The guilt and the helplessness was adding to all that. So it wasn't till really a year and a half after I'd had my son that I actually got the real mental health help that I needed. So I spent that kind of first year just surviving, really, just kind of trying to get through each day. And there was aspects of life that I kind of tried to resume normally. I didn't go back to work until about a year and a half after I'd had him, uh, just because it was in between trying to be normal. There was lots of hospital appointments, lots of checkups, lots of referrals to other consultants and specialists. And in that time period, I'd also started a medical negligence claim. I mean, I didn't feel like I had the mental wherewithal to do that, but my family and my husband were really insistent that I did because it had been life changing. So I did, but so there was that aspect of it too, um, which was a lot. And I think there was a culmination really just before my son turned 1, where I'd I'd been doing okay. And then as his first birthday approached, there was sort of all of this anxiety closing in on me. And I felt like, I was worried that the day would be not about him as it should be, because it's his birthday, but that I would have some panic attack or meltdown on the day of his birthday. So I was sort of panicking about panicking. And it took away from the joy that I should have been feeling. But I remember this one day, which was kind of like the worst day, I think, really, that I had mentally. I'd gone to an appointment at the hospital on my own with my baby, and I had a lot of medical anxiety just setting foot into any kind of hospital setting after his birth. It could make me feel like I was going to have a panic attack, or, I'd start to feel that tight chest. And I don't know really how I got through it, but I did. I managed to get through the appointment. And then as I left, I just remember feeling like I'm really unsafe, like something terrible is about to happen to us. And I had to get the bus home with him. And I remember pushing a pram down the street and thinking, like, I'm not safe. I can't look after him. I need to give him to one of these people that's walking past me, because I'm not mentally safe to look after him. Something terrible's going to happen, but I didn't know what it was. And I don't know how, but I got home with him without giving him away to a stranger. I got home and I remember sort of sitting down and thinking, I'm really unwell. And I messaged the perinatal mental health midwife, and I just said, like, I think you need to come and see me because I'm not doing well at all. So she did. She came out fairly quickly, and we did try rewind therapy, but it wasn't the right kind of therapy that I needed at that point. And so she then referred me to their team psychologist for EMDR therapy. So I had to wait a little bit longer. But once I had that, that was kind of, well, it just completely changed things for me mentally. I was able to, even just the next day after our first session, I was able to actually think about aspects of his birth and not feel upset, and to be able to just think about them and process them, and to not feel panicked. And I was able to think about that doctor and not feel panicked and not have these irrational thoughts anymore about her. So that really, really helped me. But there is no set support in place for when something like this happens. And it was a recommendation that I made to their team, that they needed to have something, like, even if it was a leaflet or something in the kind of package of things that they give you when you leave, that's kind of like, oh, this is where you need to register their birth, and all of those other things. This is what the first night at home might be like.
You're like there with all these leaflets, aren't you? You're
yeah,
like, okay, right, yeah.
And sort of all of those other things. But I said it's actually really important to include the fact that this team exists and that these are the signs that you need to look out for, that you're not well. I mean, I don't know if my recommendation was ever followed up on. I don't know if they did anything about that, but I think that is something that needs to be done as a standard, is that when you're giving people all this information about caring for their baby or caring for themselves physically after birth, there needs to be a mental health package as well. There needs to be information about who you can contact, what's normal, what isn't normal, and what are the signs of different postpartum mental health conditions that you need to look out for, and that your family needs to be aware of as well. I think that that could actually change things drastically for a lot of people. And obviously that support needs to be in place as well. Like, where do they go from there? That's lacking at the moment. And it was lacking for me. And I suppose, like, when I look back and think, when somebody has an injury with consequences that are so serious, you would expect that somebody would say, well, hang on, let's make sure that this person can mentally deal with what's happened as well. But it doesn't exist right now. That doesn't happen, and it should. Sorry, I've probably really rambled a lot.
You haven't remembered at all. You could see me nodding. I always forget when you record on Zoom, you can see both faces, but you could see me nodding because I think like you've answered the questions I've got down, so I'm gonna go off piece because they'll relate. I think the first thing you talk about, I think there's going to be so many people, Amy, at home nodding because they're talking about. I so remember when John went back to work and I knew I was getting ill with psycho. I mean, I didn't know what it was, but I knew I wasn't well. And I went to go to the post office to get, one of the many parcels because I wasn't opening the front door, and I was getting all these calls saying, "Did you get our presents?" And I thought, I've got to go and get these parcels from the post office. And I can remember being out on the street and just thinking, I stopped and just thought, I can't move anymore. Like I am not set, like I'm not safe. And I phoned John and said, you have to leave work. And I think I stood on the street for about an hour till he came home. And I said, I'm not well. Like you need to phone an ambulance. I'm not safe. And I remember when I was going home, and I said, you need to phone my mum to fly over and be here. And my mum came over and she said I was in the bed with her, and I was just like, when will this feeling go away? When will this feeling go away? But I had this horrendous feeling that if I do tell anyone about it, like that my baby's going to be taken away by social services. And I wanted to talk about that point you said because it's the biggest thing that we get asked constantly. It comes up. I think anybody who has a baby who says they're going to talk about the emotional feeling that they're feeling that isn't what they thought it was going to be, the first thing that comes out is, will my baby be taken away from me? And I think it's just, I'll talk about this at the end and I'll put it in the caption, and it's the overriding thing of the week, that it's so important to say how you're feeling because then you can get a treatment plan that's right for you. But unfortunately, like Amy says, even though we now have perinatal mental health teams across the country and specialist perinatal midwives and health visitors and wonderful people like perinatal psychiatrists, quite often people don't know these people exist. So my question to Amy is going to be like, what does good look like from healthcare professionals for the physical side of things, which you talked about earlier, to the mental and emotional side of things, which you've just talked about now. And I think that's why we see the week is still so important now, because even though things have moved on dramatically in the last 10 years, you will still have, if you look at any Facebook group, I don't know if you're on any mum's Facebook groups on Facebook or anything, or
Yeah.
go on any Instagram comments, someone will go, I'm not feeling very well after having my baby, either a month ago, a year ago, 2 years ago, beyond. And someone will go, have you heard of perinatal mental health team? And people will go, well, no, but I had the health visitor here the other day and the midwife here the other day, and I went to see my GP 6 times last week. Like, this is not exaggeration. These things happen.
Mm.
And people go, I've never heard of this. And I definitely know I was told by a health visitor. I mean, it was 16 years ago, but I remember saying, I've been reading up, but I think I might have this thing called psychosis. And John was saying, she needs to see a perinatal psychiatrist. And I remember so clearly them saying, those don't exist here. They don't have specialist people for this period. And I can remember John going, but there's this thing called a mother and baby unit I think Eve can go to. And they sent me to Nottingham. Like when you said, you sent this team over here. I was sent like to
Yeah.
this team, and I had 200 miles away from where I lived, so I could be placed in a unit. And I think we talk about all the different things that people go through in the perinatal period, and we're talking about your experience, of your birth injury here, but you've talked so eloquently and openly about how your emotions were affected by that. And I think anybody watching this who are feeling not how they want to be feeling are going to identify, because intrusive thoughts are terrifying. They're bloody terrifying. Like, we've done so many sessions on them before, but you get things like sexual intrusive thought, which everyone is absolutely terrified to talk about, after they've had a baby. Thoughts about that of harm towards themselves, or other people, thoughts of dropping the baby, thoughts. I spoke to Catherine Benfield a couple of years ago from Taming Olivia, and she talks about, how her therapy to get over her fear, of this. And you think, even though our voices are louder, it's still that if these things aren't talked about at the right level, so like you've talked about, when you're leaving the hospital, there needs to be something that tells you if you're not feeling right, it's okay to speak up and seek support. Because people still say, I really worry about saying I've had thoughts of harm towards my baby. I've really worried about saying I think I've made a bloody mistake here. Like, what have I done here?
Yeah.
I don't think I want my baby. And people go, do you love them? And people go, I don't know. It's just too much. People are frightened to say. And I think one of the most important things that we say is that, if someone does, there was a great GP a few years ago called Judy Shakespeare, who's mentioned in lots of kind of reports around perinatal mental health. And one of them was called Falling Through the Gaps. And she was like, one of the biggest things we can do as a GP is that if someone comes to you and they've mustered up the enormous amount of courage it is at the most vulnerable time in their lives to go to a doctor to say, I don't feel right, the worst thing you can do is to be like, well, I don't really know what to do with you. But we always say to healthcare professionals, even if it's not your expertise and you don't know, it means so much for someone, like you've said, for someone to go, like that health visitor who said to you, or your midwife who looked at your situations and said, is someone going to see you? Like all it takes
Yeah.
is someone to say, this isn't my area of expertise. I'm not sure, Amy, but what I'm going to do is do a bit of research, have a bit of a look around so you're not on this on your own. And I'm going to book you an appointment for tomorrow or the next couple of days, or I'm going to ring you at home to see how you are and see where I can refer you to. That first step of not feeling like you're on your own, because what happens is if a healthcare professional goes, well, I don't know, or you're sent on your way, that person can turn around, walk away, and never seek help again. And actually, there might be help there in their area, and they just don't know about it. So it's this thing about, you know, good care can look like very basic. I don't know, but let's work through this together. I'm going to do a
Yeah.
Google search for what's in the area. I'm going to ring the team at the hospital who I think might be able to guide me. I think there's a team I can refer you to, so I'll work out what form I need to fill in. Might be able to get someone to come and see you at home. If that's better for you. That's what good care can look like sometimes. And I think so many people will connect with what you're saying. We've done so many sessions on intrusive thoughts and these kind of feelings, these feelings of not feeling safe. And I think people will be nodding along at home. And it is the most terrifying feeling when you don't feel safe with yourself, when you don't know what to do about it. And then you worry that if you do say something, that social services will come in and sweep your baby, away, which we also know isn't true. And social services can be a really positive impact from people who do need their support and the services that they offer. But it is the worst feeling to have, and I can remember it so vividly. It came back to me then when you were talking about it. I remember it so vividly by saying to John, "I'm not well, like I'm not well," and I remember being so scared once that I just didn't move in the kitchen for hours. I can remember I was holding some stewing steak and it defrosted. I was like completely still because I was so scared of moving that something would happen. And I think you've so beautifully put how people deserve help and support. And I think I had EMDR when Joe was 3 after I was diagnosed with PTSD.
Yeah.
And like after 8, I found for me, I mean, therapy is different for everybody. You talked about how one thing wasn't right for you. There's
Yeah.
lots of different types of therapies, and we talk about them in the awareness week. There's lots of sessions you can look back on. But I found EMDR to be absolutely life changing in a relatively short amount of time, and I'm thrilled that it was good for you. And I wanted to just ask you a question. So we've talked there. I've babbled on too much there about because I'm not as eloquently as you. Because I think I'm just remembering, and I think I just get so. It makes me so sad that there's people that we've got
Yeah.
support, and that people don't, or people in positions of power and responsibility on not telling people where they can go to get help, you know, and I think it upsets me so much. But I think in terms of the physical side of things, you touched on this earlier. If someone has had a like a third or fourth degree tear, or you know they've had an injury, something similar to yours. And in the caption, I'll put lots of the details of what there are because there's lots of different kind of indicators. If someone's got that, and what are the issues around, or kind of where are the barriers to them being referred to the right teams or getting the right support? So you've talked about you saw lots of teams and consultants, and there was lots
Yeah.
of I'm sorry, Amy, but like, what are the barriers to people kind of getting physical support for injuries that they've encountered after birth?
I think one of the main barriers is probably waiting times. At the
Okay.
moment, it's waiting times. So whether that's to see a colorectal surgeon or to see a gynecologist, you know, it's waiting times wherever you look now, isn't it, in the NHS? I mean, hopefully that's coming down in some areas. But I think also the next thing is just not being believed about your symptoms. I mean, the day I discovered that something was wrong, I'd gone to the toilet and I had feces pouring out of my vagina. And I knew that, you know, something had gone very wrong with my stitches. I thought that they'd all come undone. You know, unbeknownst to me, I had a hole that had been completely missed between my rectum and vagina. And I phoned the maternity unit. I explained to them over the phone. They were very perplexed and just said, come back in and a doctor will see you. I went back in. I waited 4 hours to see a doctor. So, you know, that nobody sort of thought, oh, maybe we need to get somebody here quicker because, you know, the entire time I'd taken a laxative because I was worried about doing my first poo at home after having
Yeah.
my baby. And so the effects of that were happening and I had no control, couldn't stop it. You know, I was stinking out the room that I was sat in, and not one person thought we need to get somebody here quicker. So I think that kind of just the lack of urgency about injuries,
Yeah.
that what people are dealing with at home, the symptoms I had, really, I could have gone if I hadn't taken that laxative. It's kind of the thing that that saved me in a way was that I'd taken that, because I could have not taken it and then it might have been weeks before I'd realized that something was wrong. Because it was only because I wasn't passing solid stool that I
Mm.
realized that something had happened. But for other people, they may go home, they might not have taken any sort of like stool softener, and they're having trouble. And they might start off with like infections and wonder kind of like, oh, something's not right, things don't feel right. But then it could take ages for that to be identified because you're waiting to see the correct person that's going to examine you and have a look. So it's a combination of things. But I mean, then when I finally saw the doctor and explained what was happening, he didn't believe me. And he said, oh, you're numb, you're sore, and you just don't know where it's coming from. as though I
What?
as though I don't know where all the holes on my body are positioned,
Oh
you
my
know.
God. What?
And I thought, I know things can feel different after birth, but I definitely know where poo should and shouldn't be coming from.
I mean, for the love
And
of God,
I
come on.
know. And it wasn't until he actually
I
examined
can't
me
even, Amy.
and I mean, I was terrified in that moment, thinking he's gonna send me home, and
Oh my God.
I've got poo just pouring out of my vagina, and it's only that it happened there on the table while he examined me that he
Yeah.
realised I was telling the truth about
Yeah.
my own body, and that is a barrier, not being believed. The symptoms are so easily dismissed by a lot of medical professionals. Not
And
all.
it's gaslighting to say you
It
don't know
is.
your own body.
It is.
I
And that
mean,
happens a lot to a lot of women that I've come across. They're being told, oh, this is probably in your head. It's probably anxiety that's causing this pain or this issue. Well, Yeah, there is evidence that anxiety can exacerbate things, that your mental health condition can exacerbate physical conditions, but there's a source of pain. That source of pain isn't in your head all the time. There's a physical reason behind it. There's if you've given birth and then you've got problems afterwards, that was the source. Something happened there. But instead of identifying that and looking into it, like you said, even if they don't know and just said, do you know what? I don't know what this is, but let's look into it and let me speak to other people that might know.
Yeah.
But a lot of women are not being met with that. They're being met with, oh, no, I don't think it is that. Or they're being told this is normal after birth. This is normal after a baby. It's normal to not be able to go to the toilet properly. It's
I
normal
read this so
to
much,
have bladder
Amy.
issues.
Yeah.
And to a small extent, it can be for a short period of time, but not an ongoing thing a year or two later. When you're being told a year after giving birth that it's normal that you're not being able to go for a poo properly, that's not normal. It's not
No.
normal a year after birth to still be having problems like this. And that's the point where they need to kind of say, like, actually, let's look into it a bit more. I'm not sure what it could be, but let's identify it with somebody else. Let's do some tests, let's do some scans, let's examine you. But so I think there's a combination of barriers there. And because of the pressures within the NHS, I think that is probably having an effect on the time that consultants have to see people and the time in which they have in appointments to like identify all these issues. I mean, for a lot of people, just getting a GP appointment is really difficult. So just even getting that initial sit down face to face with somebody, that's a barrier for a lot of people. They can't even get to see their GP to just say, I'm having some issues and, where do I go from here? Because a lot of the time it's a GP that can refer you on to somebody within the hospital. I mean, there are some services in some hospitals that you can self-refer, like physiotherapy and things like that. But some things require like certain tests to be done first by your GP. So I think there's a combination of barriers really. And I don't think there's not a quick fix for anything, but I think a big important thing would to be actually just to listen to women when they sit down with you, if you're a medical professional, and they say, this is what I'm experiencing, to actually listen and take it seriously and not dismiss it as sort of being in their head or a result of anxiety or mental health issues that they may have, because there's still a physical reason for pain, there's still a physical reason for symptoms. Especially after giving birth, I think it's been very easy for women to be dismissed just because they've given birth, that any problems they're having after birth, it's very easy to dismiss that as a result of, oh, well, it's just a normal part of giving birth. No, not everything is. And for too long, some symptoms, just because they're common after giving birth, doesn't mean it's normal. And it's been too easy for them to write them off as, oh, it's a normal thing after birth. It shouldn't be normal. It should be normal to no longer function properly with your bladder or your bowel after giving birth. So, yeah, I don't know if I've answered that very
No, you
well,
did.
but
You did complete. I'll tell you what's interesting. We've done a couple of sessions with Fit Fanny Adams, Sarah Jane, who is a pelvic floor consultant. But I mean, she's so much more than that. Where she has brought out her pelvis, her pelvis model, and for the first time ever, like she's done this a couple of years ago, she gives her time for free, where she's brilliant. She's talked about the relationship between the bladder and the bowel, and we've talked really openly about issues that if there are issues with pooing or weeing after birth, whether it's classed as mild, moderate, or severe, she said exactly what you say. Like, it doesn't mean just because lots of people experience certain, and most people will go, oh, I've had it mild, or, whatever. It still doesn't mean you have to live with it or that it's normal. And I think what I've definitely learned from her is that some people are experiencing some really excessive amounts of issues, not realizing that they've got an injury. And she shows on the pelvis why there are issues and where tears take place, and then what, and you've described what happens if you're stitched incorrectly, or those kind of things, and actually why your body is reacting the way that it is, and that you shouldn't have to live like this at all. And I think it's really good you've talked about the medical negligence side of things, because in the caption I've got some stuff to put in that as well, so people can know that they have those options to support themselves as well. So they can kind of fight for what's right. So I'm really grateful
Yeah.
to put that in there. But I would say to people, we've got a couple of sessions where Sarah shows off the pelvis, and I know that a lot of healthcare professionals have found that really helpful, and they've we didn't realize the kind of relationship between it all, and actually that when an injury takes place, how badly things can be affected. And you've talked about that, and it's a thing about believing women. There's so many health campaigns, thankfully, where we talk about, look about it, there's blood in your poo, and look about this, take 2 seconds to look at these kind of things. All these charts about what color your wee is and if you're hydrated enough and all these kind of things. We're asking people to look at what is coming out of their body to see if things look normal or feel normal. So if a woman say she's feeling like this after birth and something isn't right, then please listen. And you don't need to be an expert, but you're the first port of call to go, let's have a think about what we can do with this, as you've said. There's one thing I wanted to, we talked about antenatal classes and stuff earlier, but there was one thing I wanted to focus on at the end, which I think is really important. And you talked about stuff around peer support, but how important is peer support when you've had a birth injury? How important when you're living with a stoma? And I will put links into places that will offer peer support and the organisations. There's places like the Birth Trauma Association and MASIC and other birth injury organisations, and we'll put those details out. But how important is the role of peer support in this, to know that you're not alone?
Incredibly important, really. I mean, it was life-changing for me. You know, you may know Jill Castle. Her yes, she's stoma chameleon.
Yeah.
So she was the first person that I found on social media who'd had the same injury as me, a rectovaginal fistula, and then a resulting colostomy bag. At the time that I found her, I was still under the impression that my colostomy would be temporary. And I was in this in-between stage where they told me it was going to be temporary, but then the more specialists I was seeing, there was more question marks over, actually, there's sort of damage to your sphincter muscle that we've identified, and we don't know what your continence might be like after a reversal. You may have issues, but then there's things we can try, but then when you hit menopause age, it may get worse. And so as time went on, there were so many things kind of like being sort of revealed about the extent of my injury that I made the decision to keep my colostomy permanently. But finding her was really instrumental in me making that decision, because up until the point where I'd found her, and I think I was probably coming up for maybe like almost 2 years post-birth injury and post-stoma. And I don't think she'd been on social media for very long at that point either. But I remember I think I came across her on Facebook first, and then I found her Instagram as well. And I remember seeing this woman who had the exact same injury as me, but her colostomy was permanent, and she's doing marathons and like triathlons and like all these incredibly physical things that I've been told, like by sort of like my stoma team, like, oh, don't lift a kettle full of water, nothing heavier than that. And obviously I had a baby, so I was lifting him, but it was sort of like, oh, hold him close to you. And then I find this woman that's kind of doing all these amazing physical things, and she's the same as me. And, we don't have the same level of fitness by any means. And I'm not about to go out and do a marathon or anything like that. But
Me neither.
just like finding her was pivotal in that she was showing that life goes on and that you can live with these things. you don't have to be doing what she's doing, but it's possible to just be living life. And it's possible to go to work. It's possible to socialize, have a social life, and do all these things with a colostomy bag. And for me, I'd kind of, up until that point, I saw it as something that was very life limiting. And I was kind of stuck in this, even though I'd had my EMDR therapy by this point, but I had this very sort of negative viewpoint of what the future could be for me. And what am I going to be able to have more kids? And after finding her, I then found a lovely lady called Rachel, who is in Scotland, and she'd had the same injury and had a colostomy as well. And I saw that she'd gone on to have another baby. And I thought, oh, wow, she's had a baby with her colostomy, and she also had a hernia too. And I remember I messaged her because at this point, I come from a big family, and I'd always wanted more than one child. And I felt desperately sad because I thought, this is it. And I'm not going to have the family that I'd envisioned. And it's taken a lot away from me, my birth injury. And what's happened is taken more than just my physical and mental health. It's taken my family picture that I'd envisioned, But then finding her and just seeing that she'd continued to expand her family after her birth injury, that was a possibility. I then sort of spoke to my colorectal surgeon about it and was like, oh, so this could be a possibility for me too. And I spoke to my stoma team and asked them about, pregnancy with a stoma. And so just finding those people opened up the world to me after that. That was more important than anything that a consultant had said, or anything that any medical professional had presented me with or told me. In fact, it was quite the opposite, because a lot of what you get told after you have a stoma is, oh, you can't do this, you mustn't do that. It's, you've got to be very careful. And yeah, you do. But actually, it's not like that for everybody. And for an awful lot of people living with a colostomy bag, they can still do a lot of things. They can still go to work, and they can have a social life. They can exercise. There's a lot. I mean, the more people I found, social media, it has its negative aspects, but there's also a lot of positive as well. And, I found like a huge amount of people who, in all shapes and sizes, all walks of life, and all have their colostomy bags for different reasons. But so many of them are just out there doing incredible things. And the same with a lot of women who are sort of in the birth injury sphere, being introduced to the MASIC Foundation. That actually happened through my medical negligence case.
Oh, really?
So it's kind of really random how it came about, but one of the independent experts that my team used was Professor Keithley, who is one of the founders of the MASIC Foundation and their chairperson. And I actually saw him in person at his private clinic as part of my case. And we spoke on the phone as well initially, because it was COVID. And he was actually the first medical professional that I spoke to that completely understood what I was going through. And his first words to me when we spoke on the phone, he said, I just want to say, first of all, I'm so sorry that this has happened to you. And he said, I've been all over the world and seen women with your injury and seen the devastating consequences all over. And I understand fully like how it impacts life. And he was the first medical professional that knew, that just understood and knew. He's probably I think it's safe to say he's probably the foremost expert in the world on the type of injury I had. He wrote the books on colorectal surgery, and he's So he is the guy to talk to about it. But he then asked me, he got in touch with me after sort of we'd had those few interactions, and he said, you know, would you like to be on our council and the charity that I've started? And he said, I think you'd be a good asset. And so I said, yeah, sure. And I've done various sort of things with them. I've done sort of a couple of webinars where I've spoken about what's happened to me. And just, yeah, and then it's kind of led up to me then doing in-person peer support for them. So, and I've forgotten what your original question was now.
No, it was that. It was about how important it was because I think I've watched all
Yeah,
your
yeah,
webinars. If there's one of them you've done, I think it's the third one across. I think it's pinned to your profile where you talk about it. It's about seven
yeah,
minutes long,
yeah.
and it's really good. No, that was my question about the importance of peer support. Probably noticed during that as well. I was taking down some notes that you were writing, so I can put them in the notes section when we put this out. But listen, I have found this. There's loads of words: fascinating, inspiring, empowering, informative, and really supportive, Amy. I think this is exactly what the Awareness Week is about. People talking about their personal experience, how they're using it to support others, and also showing what the journey can look like. And I think you have touched on so many different aspects of that. And I think this would be really great for healthcare professionals, women, and their families to look at and gain insight. And I think from that, I want to give a big thank you for being a part of the week and a big thank you for giving your
Oh,
time and
thank
your
you.
personal
Thanks.
experience. No, it's honestly, it's been brilliant. And I thank you so much. As I say, in the caption, I'll put lots of things that we've talked about and the organisations that can support, links to things to do with medical negligence for information, and then details around peer support that you can go to, like Amy talks about. But I think with that, thank you so much for your time. It's been
Thank
lovely talking to
you.
you. And thanks for being a part of the week.
Thanks very much.